Hey everyone, Dr. Eric, the fitness physician. So why do you not want to go to the doctor or go to an HRT clinic? Don't do that. So just to set the stage, this is going to be a short video training on this. I threw some topics out there because I see a lot of this where people are going to primary care or these online HRT clinics and these basically hormone mills that just kind of churn people through for just get them in and get them out. So you don't want to go to I mean, trust me, I was in a traditional medical world, but when you go to see your primary care doctor, you know how it is today. Big pharma and the big powers that be are trying to keep us down weak and stuck on pills and surgeries and artificial devices, artificial synthetic drugs to keep us in check, to give us a pill for that, a pill for this, a pill for that. You go to these hormone mills, these online clinics, or social media gurus who are proclaimed hormone experts with zero medical training, despite them saying, "Oh, well, I talk to people and I go to conferences." Well, that's great. Well, stewardesses and airline attendants, know a lot about flying a plane, but they're not going to fly the plane, right? So there's just a lot more to it under the hood. That's where the dangers are. And I don't say this to, just say, look, you got to come see me or one of my colleagues. Well, you should, but you don't have to. You can do what you want. But I'm telling you, because I see these people, my colleagues see these people by the thousands where they go to their docs, they go to these mills, and they go to these social group media gurus, and bad things happen. They get messed up. It's not as easy as it sounds like. There's a lot of moving parts. And what happens is they get put on these cookie cutter protocols or get put on these synthetic drugs and they have side effects, they have problems, they have issues, they get worse. And then they come to me or they come to my colleagues and we talk about these in cases and in a quality committee reviews, just like we did in the traditional medical world. When we talk about this and uh, we figured out like we basically un-F them, you know what I mean? So and so that's the problem is these cookie cutter protocols, they put everybody on the same protocol, everybody's on the same drugs, they treat everybody the same way, maybe a few tweaks here and there, but that's it. Or worst case scenario is they just get pills at their doctor or these clinics and they don't do a deep dive. And that's why I do what I do. I do cellular medicine, muscle medicine. I do a deep dive and I figure out what is going on, why is it happening, and let's fix the underlying cause. What we call root cause precision medicine. I'll look at your genetics, your gut, your lifestyle, diet, supplements. We may have to do some nutrigenomics analysis and figure out what's going on, why maybe you can't absorb certain nutrients or you need more nutrients based on others, based on your genetics, based on your hormonal panel, based on your lifestyle, based on your what you eat and what you don't eat. There's a lot more to it. And when you affect this like dominoes, when you affect one, you affect the other. So everyone is different. Yes, there are some standard things that they're not standardized in terms of the approach, in terms of how often you're giving a medication. This is the things you want to ask your doc. What do you do? What do you test? How do you test it? Do you do serum blood testing? Do you do stool samples? Do you do genetics? Do you do salivary tests? Do you do urine tests? What kind of treatments do you offer? Pills, injections, creams? What kind? Where are they sourced from? What are they made out of? How often do you get it? How often do we see you for follow-ups? What other follow-up testing do you do? What other things do you evaluate me for based on my symptoms, not just a standard 5, 10 question thing and you're out the door? Or does everybody get the same thing? These are the kind of questions you want to ask. You want to ask them what they're doing and why they're doing it and what else they can do. And that's what I learned back when I was an ER doc is what I call them the W's, right? What else, what's going on? What else could be going on? What else could this be? What am I going to do to look into it? What else can I do to fix it? So it's the 5 W's. I always live by that because sometimes you get stuck in this mode of thinking and you're missing something out here. It's kind of the joke that I tell my patients sometimes, like, well, doc, I got a headache. I just want that Motrin. My doc's just give me Motrin because my head hurts. Why does your head hurt? I don't know. It helps. We turn around, they got a big nail sticking out of their head. Well, that's why I pull the nail out and now you fix it. So same thing with hormonal issues or gut issues or fatigue or if you're tired or overweight, just not losing weight. Well, why? Let's figure out why and get to the root cause. Go down to the cell, go down to the cellular medicine approach, which is what I do and a lot of my colleagues do, is to figure out why and see if we can fix that. And then maybe you don't need all this stuff. Maybe you just need this for a short period of time and then you're done and then you're on your way. I don't know about you, but is anybody out there having issues like this? You're brain fog, fatigue, tired, just not getting answers, not getting anywhere, gaining and losing weight, and just stuck on the treadmill over and over, just not figuring things out. Well, we can help with that. I can help with that. So reach out to me and I'll teach you how, and we will learn how to get to the root cause and figure out what's going on and see if we can fix that and fix it and make it better. And then you're not stuck on this pattern over and over and over again. So anyway, so that's the dangers of these protocols, and that's why I tell people, say, don't go to your doc, don't go to these mills and these online clinics because you're going to see problems. I'm not saying that just to have you come see me or my colleagues. I want the best for you. I want the best for my clients and my listeners, whether you see me or not. I just want you to do the right thing. Do a deep dive, figure out what's going on and why. Ask these questions, and then you'll have a better insight into best way is to go and what better and what not to do, because I don't want you to get hurt. I don't want to see you have bad things happen, have side effects, issues, and problems. I want you to get best. My patients, I want you to live prime, live your best life so you can live to give and give back to others. So if you're interested, just please like and share this post, and please DM me if you want a one-on-one, a quick discovery call with me, and then check me out online. I'm happy to do a consult. We can set you up for a consultation. But if you have a couple quick questions you want to ask about my process, DM below, hit call. DM call below and message me, shoot me your email, and I'll get you my free newsletter that I send out to my clients every month and get you on the list. And we can do a quick discovery call, figure out what's going on, see if you're a fit for the program or not. I have multiple programs I can do. So DM that below if you're interested and reach out with any questions. Ever have an awesome day, and we will talk to you soon.